When seeing an early negative test result, most people wonder if they could still be pregnant and if they might test positive later on in the cycle. Fertility Friend is in a unique position to help with this question. We design a study specifically to try to shed some light onto this issue. The purpose of this study is to look at the statistics of early negative pregnancy tests, commonly called BFN, big fat negative in the community, when later followed by a positive pregnancy test, BFP, big fat positive in the community lingo in the same cycle. So can you still be pregnant after a negative pregnancy test? If the negative test was taken too early, the answer is most definitely yes. Please check Fertility Friend's chart gallery for numerous examples. You could still be pregnant and just testing too early to see a positive result. It is interesting, however, to look at some statistical data about these pregnancy test results. To explore the issue of the reliability of early pregnancy tests, we looked at just under 6,000 charts for which a negative pregnancy test was followed by a positive test and did not result in a very early miscarriage. First negative pregnancy test before positive. We calculated an histogram representing the frequency distribution of first BFN when followed by a BFP. The data shows that negative tests were taken on average 9.08 days past ovulation, DPO, with a median at just 9 DPO. The cumulative histogram shows that by 11 DPO more than 80% of the negative results have been accounted for. First positive pregnancy test after negative. The frequency histogram shows an average of 12.72 DPO for the first positive pregnancy test and a median of 12 DPO. The cumulative histogram shows that 80% of the positive results are taken before 14 DPO. Discussion and conclusions. Not surprisingly, we have to wait for 14 DPO to see 80% of the positive tests accounted for. This is quite in line with a separate study that we also conducted. In this sample, though, we have slightly earlier testing and most likely with more sensitive tests as well. More interesting is the conclusion that we can draw from the BFN data. According to the community data, if you get a negative test beyond 11 DPO, your chance of getting a BFP later on is significantly reduced. In other words, if you get a negative before 11 DPO, there is still a good chance that you could get a positive later on. It is also a reminder that if you can do so, you need to delay your testing as long as possible. Obviously, though, there are real reasons to have to test earlier beyond simple curiosity. Thank you for listening. If you have not done so already, visit fertilityfriend.com for more details.